Hello, and welcome to our presentation. Today, we will be discussing the diseases associated with the growth hormone in the endocrine system, specifically acromegaly, also known as gigantism, and growth hormone deficiency, also known as dwarfism. In this insightful discussion, we will examine the endocrine system, focusing on acromegaly and pituitary dwarfism, which stem from opposing issues related to growth hormone production. Acromegaly results from an excess of growth hormone, leading to the enlargement of various tissues, whereas pituitary dwarfism is caused by inadequate hormone levels resulting in stunted growth. Both conditions have significant implications for metabolism and energy levels. Treatment options include medication, surgical intervention, and in some cases, radiation therapy to regulate hormone levels. Acromegaly for adults is a hormonal disorder that happens when the pituitary gland or the small gland at the base of the brain produces too much growth hormone. After growth plates have closed, which occurs after puberty or in adulthood, this results in tissue overgrowth and metabolic complications. Acromegaly in adults is characterized by elevated growth hormone levels that occur after the fusion of growth plates, resulting in enlargement of the hands, feet, jaw, and soft tissues, rather than an increase in height. In contrast, excess growth hormone during childhood prior to puberty leads to gigantism, which is marked by significant height growth. The key distinctions between the two conditions are as follows. Acromegaly affects adults, results in tissue enlargement, whereas gigantism impacts children, leading into increased height. In children, the lack of growth hormones causes pituitary dwarfism, where growth is stunted but body proportions remain normal. In adults, growth hormone deficiency can develop after pituitary damage and leads to metabolic and psychological symptoms rather than short stature. Let us examine the underlying cause of acromegaly. The principal factor is the excessive secretion of growth hormone, typically resulting from a pituitary adenoma. The overproduction of growth hormone stimulates the liver and other tissues to increase production of insulin growth-like factor 1 or IGF-1. Consequently, this leads to abnormal growth of bones and soft tissues. This process ultimately results in the characteristic features of acromegaly, which induce enlarged hands, feet, and facial structures, alongside various systemic complications. It is important to note that this condition encompasses more than just a physical alterations. A metabolic imbalance is also involved. Moreover, while factors such as stress and puberty can influence hormone levels, they are not directly related to acromegaly process. Pituitary dwarfism arises from insufficient secretion of growth hormone due to dysfunction in the pituitary gland or hypothalamus. This condition has a variety of potential causes, including congenital genetic mutations, abnormalities in the pituitary gland, trauma, tumors, surgical procedures, or even radiation therapy. In some instances, the precise cause remains unidentified, a situation referred to as idiopathic. This condition underscores the intricate balance maintained by our hormonal systems to facilitate growth and development. A thorough understanding of these causes enhances our appreciation for the complexity of such disorders and emphasizes the necessity for personalized treatment strategies. It serves as a crucial reminder of the importance of accurate diagnosis and timely intervention in healthcare.
So, what happens in the cellular level in acromegaly? Growth hormones act on the liver and other tissues to stimulate production of insulin like growth factors or IGF-1 for short. IGF-1 promotes cell proliferation, protein synthesis, and tissue growth. In acromegaly, this signaling pathway is overactive, leading to abnormal proliferation of the bone, especially in the skull, in the areas in the skull and jaw. Cartilage and soft tissues and organs such as the heart, livers, and kidneys enlarge, and skin thickens due to increased collagen deposition. In pituitary dwarfism, on the other hand, With the insufficient growth hormones, the liver produces less IGF-1. In children, this means reduced contractile proliferation, proliferation at the growth place, impairing bone elongation, and in adults, low IGF-1 leads to reduced protein synthesis, decreased bone density, and loss of muscle mass. And now let's move on to the metabolic impact of the two diseases in acromegaly. Chronic growth hormone excess causes insulin resistance, leading to hyperglycemia and diabetes. Patients often develop hypertension, dyslipidemia, and cardiomegaly, raising cardiovascular risk. There's also an increased risk of colon polyps and colorectal cancer due to the abnormal cell proliferation. And as per pituitary dwarfism, children will have a shorter stature, will also delay their puberty, and sometimes hypoglycemia. And in adults, it will increase visceral fat, reduce their lean muscle mass, decrease bone mineral density, it will give them abnormal lipid profile, fatigue, and depression. These changes increase cardiovascular risk and reduce quality of life for those who are affected. And now for the treatment strategies for treatment for both diseases. Acromegaly can be treated by the surgical removal of the pituitary adoma, usually via a transfiniodal approach through the nasal cavity. For medication, some of the statin analogs like atritide and lanreotide suppresses growth hormone release. Pegvisomant blocks the growth hormone receptor. Dopamine agonists like cabergoline can reduce the growth hormones in some cases, and radiation therapies will be needed to for any surgery and medication if they're not fully active. And as for pituitary dwarfism, daily subcutaneous injection restore growth hormone level and normalize growth in children and in adults. Therapy improves body composition, bone density, and energy levels. And it's also important to address the underlying cause for once. And if present, you removing the pituitary tumor is utmost important. Is at utmost important, and also just managing the damage in the pituitary glands. You also need to monitor it, as the GH therapy can cause underlying side effects such as edema, joint pain, and insulin. So it is needed. It is much advised to do regular follow-ups to the doctor. And that's about it. Thanks for listening to our presentation. Thank you and have a nice day.